Hello and welcome to American Heart Association Heartsaver First Aid. We're going to begin by discussing what first aid is. First aid is the immediate care that someone can provide for somebody who is ill or injured. The majority of the things that first aid will address are for minor illnesses, but there are several life-threatening emergencies and illnesses that we will cover in first aid. It's important for us to know how to do first aid and how to perform CPR, because it truly can make a difference in the lives of the individuals around us. We never know when an emergency may arise, and we might be able to help someone that we care about. There are several reasons why many people will not help. This includes being uncertain as what to do. They're worried that what they're going to do is wrong. They're afraid of catching some type of disease. They're afraid of being sued. Please understand that if you practice first aid within the scope of what you have been taught, you are covered under the Good Samaritan Acts. You also have very little risk of catching a disease if you remember to wear your personal protective equipment, and we'll discuss that as we go through as well. So the first thing that we need to make sure that you do is to keep yourself safe. This is the number one thing to do. You're not going to be able to help to anyone if you are injured and can't render care. So make sure the scene is safe. Then you're going to establish if the person needs help. Introduce yourself, ask them if they need help, call 911, and get some more help on the way. If a person can't respond, assume that they need help. Remember, when you are asking someone to call 911 and get the AED, you need to look at them, try to address them and put responsibility directly on them. Tell them to go get the AED and call 911. It's important to single somebody out by name or what they're wearing, because this gives them a sense of responsibility that they have been singled out, and they are more likely to go and do that for you. Then you are going to begin your process of finding out what is wrong and taking action. You are a vital part of the American Heart Association chain of survival. The chain of survival begins with activating the emergency response system by calling 911, initiating high-quality CPR and first aid, the use of an automated defibrillator. Then advanced care takes over, and the hospital care and recovery will begin. The second most important thing that you need to do after you make sure the scene is safe is to protect yourself. You're going to protect yourself by using universal precautions. Our general rule is if it is wet and sticky and not yours, then do not touch it. Your protective personal equipment can include gloves, eye protections, mask, including CPR mask and seals like that, so that you don't receive anything during CPR. So how do we find out if a person needs help? You're going to begin to do an assessment after you establish that the scene is safe. Begin to speak with the person, listen carefully, take note of their level of consciousness and how they are talking and how they are breathing as you speak with them. If the person is unconscious, check for breathing, listen for any noisy breathing or irregular breathing. If a person is not breathing, then begin CPR immediately. Look for any obvious signs of injury, and also take time to look for any medical jewelry that the person might be wearing. You're going to see a short video that shows you how to put the steps of the assessment into practice now.
First, check the scene to be sure it is safe.
Okay, the scene is safe.
Next, tap the victim's shoulder and shout to check for a response.
Hey, are you okay? Are you okay?
If the victim responds, ask if you can help and ask what the problem is. If the victim does not respond or moans or groans, phone for help.
You call 911 now.
Then open the airway with a head tilt chin lift and check for normal breathing. Look for bleeding and any type of medical information jewelry.
We are going to divide the remainder of the first aid portion into 3 major categories: medical emergencies, trauma emergencies, and environmental emergencies. Medical emergencies are things that occur suddenly and may threaten a person's life if it is not corrected immediately. When we do our assessments, we really want to stick to our ABCD: airway, breathing, circulation, deformity. So we go head to toe, we assess their breathing, we assess their airway. We can do this simply by speaking with a person. Breathing problems that we can have is they are too fast, too slow. Are they gasping for breath as they are trying to talk to you? Do they have any noisy breathing? Or is it that they can only make and get out a few words at a time? One of the most common breathing problems that you can encounter is asthma. Asthma is a chronic disease that is an inflammation of the bronchioles and bronchi. Often this is treated with an inhaler. In some cases, you may need to assist individuals with taking their medication. Please keep in mind that you may have to give a person their medication, but as long as it is their own medication, it is considered with assisting them in taking their medication. For asthma, many people who have asthma will need an inhaler, and those inhalers are often used with a spacer. Allergies can also cause breathing problems. Common allergies can be to peanuts, bee stings, shellfish. When we have a major allergic reaction, it might call for the use of an epinephrine pen or an EpiPen. Signs of a mild allergic reaction are just a stuffy, runny nose, itchy eyes, itchy skin. They may have a rash. Severe reactions are when we see swelling to the tongue, face, trouble breathing, and we're seeing signs of shock. With a severe reaction, that is when we are going to treat with the EpiPen. You will watch a short video on how to administer the epinephrine pen now. You can administer the pen to a person if they are unable to do so on their own. Please remember that an epinephrine pen is designed to go directly through the clothes. Just be cautious when you are done with it that you do not get stuck by the sharp.
If the victim is able, let him or her give the injection. If the victim can't give the injection, you can help give it if you have been trained and your state and work site allow it. To use the epinephrine pen, take off the safety cap. Hold the pen in your fist without touching either end and press the tip of the injector hard against the side of the victim's thigh, about halfway between the hip and the knee. The needle is designed to go through skin and through clothing. Hold the pin in place for several seconds. After you take it out, make sure you don't put your fingers over the end that has been pressed against the victim's thigh, because that's where the needle is. Rub the injection spot for several seconds. After using the injector, put it in a safe container like this one.
Choking is another airway issue. This is when food or an object blocks the airway and keeps air from being able to get into the lungs. We have mild choking, which is when an individual is still able to cough, talk, and is moving some air. But we can also have a complete blockage of the airway, and the person will not be able to cough, talk, or speak at all. And this is when you need to administer the Heimlich maneuver. The Heimlich maneuver can be administered on infants, adults, and children. Children are from ages 1 and up to puberty. Adults are from puberty on. The way that we give the Heimlich maneuver to an infant will slightly differ than what we do with an adult and a child. Both adults and children will receive the Heimlich maneuver or the abdominal thrust. If an individual becomes unconscious while you are administering the Heimlich maneuver, you need to begin CPR immediately. You will watch a short video that will demonstrate the proper technique for delivering the Heimlich maneuver. You will also practice this technique and clearing an infant's airway in your practical portion of the first aid session. Remember that the universal sign for choking is an individual holding both of their hands to their throat.
First, ask if the victim is choking.
Are you choking?
If the victim nods that he or she is choking and cannot talk, you must act.
I'm going to help you.
When a victim is choking, you need to give thrusts slightly above the belly button. Kneel or stand firmly behind the victim and wrap your arms around his or her waist so your fists are in front. Make a fist with one hand. Put the thumb side of your fist slightly above the belly button and well below the breastbone. Grasp your fist with your other hand and give quick upward thrusts into the stomach. In a real situation, you would give thrusts until the object is forced out and the victim can breathe, cough, or speak, or until they stop responding. If you cannot remove the object, the victim will stop responding. In this case, yell for help. And if someone comes, send them to phone your emergency response number and get the AED. Lower the victim to the ground, face up, and start the steps of CPR. If the choking victim is in the late stages of pregnancy or is very large, put your arms under the victim's armpits and your hands on the center of the victim's chest. Pull straight back to give the chest thrusts.
A heart attack is a common medical emergency that people can encounter. The first few minutes of the heart attack are important, and the most important thing at this time is to recognize the signs of the heart attack and to get them help. Many people will deny that they're having a heart attack. They just think it might be indigestion or something along those lines. It is always better to be safe than sorry and err on the side of caution. If someone begins experiencing chest pain out of the blue, they really should go get checked. Some signs of a heart attack can be chest discomfort that's in the center of the chest. Some people describe it as like a pressure or an elephant sitting on their chest. It can often radiate into the jaw, the neck, back into the shoulder blades. Everybody's pain receptor sites are a little bit different, so everybody can experience the signs of a heart attack a little bit differently. Individuals could also experience shortness of breath, cold sweats, nausea, and dizziness. In women, elderly, and the diabetics, we see some less typical symptoms. Often they will not experience the traditional crushing chest pain of a heart attack. They often have a discomfort, pain in their shoulder blades. They complain mainly of maybe not feeling well, shortness of breath, nausea, and vomiting. Treatment for someone you suspect with having a heart attack is to keep the person calm and keep them at rest. Call 911 so we can get them help as quickly as possible. And if you have aspirin, you want to go ahead and give them a total of 324 milligrams of aspirin. Tell them to chew it, even if it is a non-chewable aspirin, because we would like the aspirin to absorb quicker into their body. Aspirin keeps platelets from sticking together. And the issue with a heart attack is that there is an injury in the heart somewhere, a blockage, damage to a vessel, and platelets are a first line of defense for injuries. And they're very sticky little blood cells. So they rush to that spot and they pow up and they stick together. In a heart attack, this can make the heart attack worse, and aspirin will actually keep those platelets from sticking together. So administering aspirin to somebody that we suspect of having a heart attack is an important treatment. A stroke is a medical emergency that occurs when there is a stoppage of blood flow to the brain. The signs of a stroke normally come on suddenly. This is a medical condition that needs to be recognized as quickly as possible, and they need to receive treatment as quickly as possible. There are certain medications that can only be given within a certain time frame, so it is very important to recognize the signs of a stroke and to note the time when those symptoms began for the patient, because if we cannot narrow down that time of onset, then some of the medications that can be given to that individual are no longer an option. Signs of a stroke include numbness and weakness on one side of the body, confusion, trouble speaking, a slur to the speech. They often complain of having the worst headache of their life. We really do need to be very aware of these. Facial droop, slur to the speech. Recognize these signs and get them help as quickly as possible so that they get the best chance of a recovery with minimal amounts of damage. Shock is a condition that develops when there is not enough blood flow to the cells. This can come from multiple different reasons, including a loss of blood. It could come from being very dehydrated. It could come from a very bad heart attack or a severe allergic reaction. Signs to look for shock include being weak, faint, or dizzy. They have that very pale grayish. They're kind of cool and clammy to the touch. And they can also be very agitated and restless. The way we are going to treat shock is we are going to keep them calm. We are going to get them to lie down, cover them up, keep them warm, get their feet raised, and get them to more advanced care. Diabetes and hypoglycemia. When we talk about someone who is a diabetic, we are talking about a disease that affects their blood sugars. This could be too much or too little blood sugar that causes them problems. Low blood sugars are much easier for us to treat, especially if the person is awake and able to swallow. An individual with high blood sugar is going to need to be treated with insulin. So they will either need to take their own insulin if they are a known diabetic, or they will need to be transported to the hospital in order to get treatment there. Signs of high blood sugar are going to be a very sweet, sickly smell to their breath. Their body is literally trying to blow off all of that excess sugar. They may be confused, but they're going to be complaining of being very thirsty, frequent urination. Individuals with low blood sugar, they could even experience seizures or unconsciousness. Common complaints with low blood sugars are they are pale, diaphoretic, and sweaty, confused, and an altered mental status. Low blood sugars are much easier for us to treat as long as they are awake. If individuals with low blood sugar are awake, we need to simply give them something that contains sugar. You do need to make sure that you are looking at the ingredients as to what you are giving them. Many of our foods now contain sugar-free additives that will not raise their blood sugars. Fruit juice, milk, sugar, honey, a regular soft drink are good things to raise their blood sugar. I frequently will use a piece of peanut butter bread or peanut butter crackers because the protein will let their blood sugars stay up longer, and the carbohydrates in the bread or crackers will bring them up more quickly. It is important to note that candies like chocolate and that will not have the same sugar content as other things, and it will take longer for those things to raise their blood sugars. Seizures. There are many causes of seizures. Seizures are the abnormal electrical currents in the brain, so the brain's electrical system is just continuing to fire. These causes can be low blood sugars, head injuries, they could be heat-related injuries, poisons. These seizures could be full body seizures where we see them fall to the ground and we have full jerking of the arms, legs, or they could be focal seizures where they kind of just fall out. The biggest thing for us to do when we are looking at an individual who is having a seizure is we need to protect them. Never put anything into an individual's mouth who is suffering from a seizure. You just need to protect their head and neck so that they do not injure themselves anymore. Fainting is when a person stops responding for a few minutes and then appears to be fine. This is caused by a lack of blood flow to the brain. Causes can include not moving for a long time and being in one position and then standing too suddenly after squatting, or receiving bad news. Often what happens is once the person hits the floor, the blood flow is restored and they wake up and they are fine. Many of these individuals do not require transport to the hospital if they wake up within a few seconds. Your main action is to have the person kind of lay still, recover, monitor them, check to make sure that there were no injuries that occurred when they fell. After an individual has been laying flat for a few minutes and they feel able, you can see if they can sit up and how they feel when they come to a sitting position. You need to continue to monitor this person and make sure that when they change positions, there's not a relapse of unconsciousness. This brings us to injury emergencies. Injuries are something that we need to make sure to stabilize quickly so that we can prevent any further problems from occurring. Injuries that we will talk about is bleeding that you can see, bleeding that you can't see, head, neck, and spinal injuries, broken bones and sprains, burns, and electrical injuries. Bleeding is something that always needs immediate attention. We do need to remember, though, that bleeding can often appear a lot worse than it is. But when we are talking about bleeding, we can't see this could involve large blood vessels, and it could cause an individual to lose a lot of blood within a very short period of time. This could come from being hit hard in the chest or abdomen. It could come from falls, sports injuries. Many times with bleeding we can't see. We will see the same signs as we see with an individual who is in shock, where they will be cool, clammy, they may be complaining of pain in areas. We need to treat this individual the way we would treat for shock. We need to lay them down, keep them warm, try to raise and elevate their feet, call 911 and get them help as quickly as possible. Now, bleeding that we can see, we need to make sure to understand that bleeding often looks a lot worse than it actually is, especially when we're talking about any injuries to the head, hands, and feet. You have a lot of blood vessels that end there, and since there are a lot of blood vessels that end there, injuries there tend to bleed a lot. First aid for bleeding is to apply direct pressure with a bandage. This could be a clean rag, this could be a paper towel. Oftentimes in first aid, we need to make sure to use what's around us, either what's in our first aid kit or what's in our surroundings. If the bleeding does not stop with direct pressure, you need to make sure to apply a second bandage on top of that and press a little bit harder. We do not want to continue to remove those bandages and put a new one on, because every time you do that, what you're doing is you're ripping off the clots that have already formed, and you're making the bleeding start all over again, and the body has to then try to make more clots, and this is going to keep the wound from stopping bleeding. If we are talking about minor scrapes and cuts, we need to wash those with soap and water. We do not want to use things like peroxide or alcohol to treat those. We want to clean them with soap and water, because alcohol and peroxide can cause more damage, and it could actually cause an individual to go into shock. So we clean with soap and water, apply a dressing to that. Later, you can also apply a thin layer of antibiotic ointment to help prevent infection. If we have more major bleeding or more severe bleeding, it is completely appropriate to go directly to applying a tourniquet. If you walk in and you have blood splurting across the room, it is perfectly acceptable to go directly to applying a tourniquet. You can have tourniquets that are pre-bought, pre-made. These are quick place tourniquets. They can be purchased online. You can apply a tourniquet to any of the extremities. Your tourniquet can just not be placed on a joint. You need to place a tourniquet 2 inches above where the bleeding is. You're going to tighten it down into place until the bleeding stops, and then you're going to note the time and make sure to call 911. If you do not have a commercial tourniquet, you could make a tourniquet out of a strip of cloth, and then you could use a stick or something like a screwdriver or something to tighten that down and wench it till the bleeding stops. I would caution you to not use something like a belt, because once the belt is cinched down, you can't take a leather belt and twist it and get it any tighter than you initially got it. While administering first aid, there are multiple different types of wounds that may be bleeding. These types of wounds could include bleeding from the mouth or nose, tooth injuries, eye injuries, penetrating or puncture wounds, and amputations. A nosebleed is probably one of the most common things that you would encounter. Nosebleeds can come from injuries, or it could come from medical emergencies like high blood pressure. The way to treat for a bloody nose is to pinch the nose on both sides of the nostril just below the bridge of the nose. Have the person sit and lean forward, tilting their head forward. You can also apply a ice pack to the back of the neck or up above the bridge of the nose in order to try to help slow the bleeding. If doing these things does not stop the bleeding within 15 minutes, or there is gushing blood, or they are having a very hard time breathing, then this individual will need to be seen in the emergency room and 911 will need to be called. Bleeding from the mouth. One of the biggest issues that we are looking at with bleeding in the mouth is from blockage of the airway from either the blood or the teeth. So when we have bleeding in the mouth, you do need to check to make sure you check for any loose or chipped teeth. If there is a tooth that has been knocked out and you can recover it, you can put that in milk or water and it can be transported to the emergency dentist, and they possibly may be able to replace that tooth. You want to clean the mouth with a little bit of saline or water. Give the individual a piece of gauze in order to try to hold pressure on the wound. If there is breathing problems or you cannot get the bleeding to stop, you need to call 911 and get the individual to the emergency room. Penetrating and puncture wounds. The biggest thing that we need to realize, if there is an object that has penetrated and it is still in place, we do not want to remove that object. Removing that object can actually cause more damage. It could also increase the amount of bleeding that we see. So we are going to leave that object in place. We want to stabilize around it. Try to keep the patient still and from moving, and transport them to the hospital, where we would then allow them to remove that object so that they could control the bleeding as they do so.
3 ways to help stop the bleeding are direct pressure, packing the wound, or applying a tourniquet. Direct pressure can be used for wounds that are minor and continue to bleed, or wounds that are possibly life-threatening. First, use the heel of one hand to press down on the dressing. Put your other hand on top of the first. Try to keep your arms straight as you press down firmly. Direct pressure should be firm, steady, and constant. Keep pressing and don't stop to add more dressings. And don't take a dressing off once it's in place. Doing this could cause more bleeding. If the bleeding does not stop, press harder. Keep pressing down firmly until help arrives or the bleeding stops. If you stop pressing too soon, the wound might bleed again. Once the bleeding stops, wrap a bandage over the dressings. Make sure it's firmly in place. You can also do this if you're not able to keep pressing down. The bandage will keep the dressings from moving. There are special dressings that sometimes help stop bleeding. They are called hemostatic dressings. They contain a material that helps blood to clot so that it stops flowing. Most home first aid kits don't have these dressings, but it's good to know about them. What if the bleeding still doesn't stop? Then you need to pack the wound and apply direct pressure. Packing the wound means pressing material tightly into the wound. Use gauze or a clean cloth to do this. Then apply direct pressure on the wound until help arrives or the bleeding stops. Pack any life-threatening wound, including the head, neck, chest, or abdomen. Apply a tourniquet if direct pressure and packing the wound do not control the bleeding. Manufactured tourniquets can only control life-threatening bleeding on arms or legs. There are many types of tourniquets. Let's learn how to use the windlass rod type. First, place the tourniquet 2 to 3 inches above where the arm or leg is bleeding, on the side of the injury closer to the heart. Never put a tourniquet on a joint, such as a knee or elbow. Instead, go above the joint if needed. Next, pull the free end of the tourniquet to make it as tight as possible. Then secure it. Now, twist the windlass or knob until the bleeding stops. You must twist the windlass as tight as possible to stop life-threatening bleeding. This will often cause pain, but it will slow blood loss. Finally, secure the windlass. Write down what time you applied the tourniquet. If the person keeps bleeding after you placed a manufactured tourniquet, add a second manufactured tourniquet. Place it above the first one on the side closer to the heart. Write down what time you applied the second tourniquet. Once you have the tourniquet in place, leave it alone until someone with more advanced training arrives and takes over.
Eye injuries can happen in a variety of ways. This could come from being hit in the eye or something going into the eye. Signs to look for include pain, trouble seeing, blurred vision, redness, swelling. If it is an eye injury where there has been a hit to the head or the eye, or it has been punctured, we need to instruct the patient to keep their eyes closed and to call 911 and get them to the emergency room. If there is an irritant that is in the eye, what we want to do is we want to flush the eye with a lot of water. And when we are flushing irritants from the eye, we do need to remember to flush from the corner of the eye or where the nose is towards the ear. We never want to flush from the ear towards the nose, because flushing from that direction can take the irritants from one eye and allow them to go towards the other eye. If after trying to irrigate the eyes, the objects cannot be flushed out or there is still irritation, call 911 and have the individual transported to the emergency room. In the case of an amputation, if the body part can be recovered, it may be able to be reattached. But you do need to realize that our priority in an amputation is not the amputated part. It is controlling the bleeding from the amputation. If the amputated part can be found, then and the bleeding has been controlled, then it is okay to take and worry about treating the amputated part and preparing it to be able to be transported to the hospital. The way that we handle an amputated part is we rinse it with water. We cover the amputated end with a piece of gauze, place it in a plastic bag, and write the person's name on the bag, place that on ice or in ice water, and send it to the hospital with the person. But again, we do need to remember that our priority is controlling the bleeding, not taking care of the amputated part. We also need to remember that if we do have the amputated part, we never want to place the amputated part directly on ice or directly in the water, because we could damage that part and it would keep it from being able to be reattached. Head, neck, and spine injuries. Our head, neck, and spinal injuries can occur in many ways. This could be from falls. This could be from a car accident. Actions are always the same. Minimize the head and neck movement, call 911, and get them help right away. Also, you need to suspect anybody who is very confused of having some type of head injury. If they are complaining of a headache, trouble seeing, trouble walking, or acting sleepy and confused, we need to get that person to stay still. We need to get them transported to the hospital. We also do need to take into consideration that somebody who is intoxicated is always suspected of having a head injury because they are not able to be assessed properly to determine whether it is from the alcohol intoxication or it is from the actual head injury. Sprains, strains, and broken bones we treat with the RICE mnemonic: rest, ice, compression, and elevation. So if we do our assessment and we note a deformity, we want to control any bleeding first. We want to cover and dress any of our open wounds. We want to apply ice for 20 minutes on, 20 minutes off for the first 24 hours. It is heat after that. We want to use real ice as opposed to a chemical cold pack because real ice gets much colder than a chemical cold pack does, and it stays colder for longer. If there is any angulation or deformities, we need to splint in the position that it is found. There are many things that can be used in order to splint a fracture. It could be a rolled up piece of newspaper. It could be a piece of wood. It could be a stick. It could be a pillow. Pillows are great splints for feet, ankles, hands, and wrist. As long as we can use it and secure it in place to help reduce the movement. Burns. Burns can be caused by heat, steam, electricity, or even chemicals. Heat burns occur because of contact with fire, a hot surface, or a hot liquid or steam. The main action for treating burns is to cool it immediately. We want to use cool water on our burns, not ice or ice water. You want to run cold water over the burn until it doesn't hurt. Then the burn needs to be covered with a sterile, dry dressing. If we have very, very large burns where we might have more full body burns, make sure that the fire has been extinguished. Remove any jewelry or clothing that is not stuck to the skin. Make sure you are checking for signs of shock. With very large burns, we want to make sure we are covering the patient with a blanket in order to maintain their heat, because individuals who are suffering from very large burns have trouble regulating their temperatures. We also need to be concerned with infection for anyone that has burns, because we have opened up the skin and burns are very prone to infections. Electrical injuries can affect both the inside and outside of the body. In many cases, we will see an entrance and an exit wound from an electrical injury. The most important thing with dealing with suspected electrical injuries is to really make sure that the scene is safe. You need to be very observant in these types of situations to make sure that
the next portion
the electricity
of first aid
that
addresses
has injured the patient
environmental
has been turned
emergencies.
off, that they are not still in contact with something that is able to transmit electricity to you. You need to be aware of water or metal surfaces and the downed wires, things like that, that could pass that electrical current on to you. This is also something that we need to keep in mind when we are using the AED. We never want to be in contact with that patient when we actually deliver the shock, because the shock can be passed from the patient to you. And that electrical impulse can have an effect on your heart and cause us to have a second patient. Once you know that the scene is safe and you are able to gain access to the patient, you need to assess the patient. If the patient does need CPR because they are not breathing, begin CPR immediately. Then you can begin to assess for other injuries from the electricity. This may involve bandaging and dressing burns in this case. Environmental emergencies involve things like insects or animal bites, but they also involve extreme heat and cold situations. We will also address poison emergencies and overdose emergencies in this section. In most cases, our bites and stings are going to be minor and nothing that is a major wound. If the skin is broken, we do want to treat that area like a wound. We want to clean the wound with lots of running water. We want to stop any bleeding with with pressure and a dressing. So this could be when we are dealing with any type of animal bite or even a human bite. Make sure you are cleaning those wounds with soap and water only. Again, we do not use alcohol or peroxide in order to clean any of those wounds. Insect bites and stings are a very common issue. In most cases, there's only a mild irritation, but we can have some very serious, even fatal reactions to these things. If a person has a severe allergy and they have an EpiPen, you may assist them in taking their EpiPen. If we are dealing with something like a bee sting, what we need to do is we need to make sure that we remove the stinger. Bees often leave the stinger behind, and when they do leave the stinger behind, attached to that stinger is a venom sac. So when we remove that stinger, we want to make sure that we scrape it out, that we don't grab it with like tweezers or something along those lines. We want to use the side of a credit card, a key, our nail to scrape and push it out of the skin so that we do not inject more venom into the person. We're going to want to wash that area with soap and water, apply ice, again for 20 minutes. We need to make sure we are monitoring and watching for any type of reaction to occur. You can at this point also give them over-the-counter medications for an allergic reaction and the local irritations that might occur. Benadryl would be acceptable. You also may want to apply a hydrocortisone cream to the area after you have applied ice. If we are talking about snake bites, if it is possible, identify the snake and try to get a good description of what it is. If we are not sure of what type of snake it is, we need to assume that it was a poisonous snake. Again, we need to assure scene safety here. This is a time when it's going to be important to have the individual remain calm so that we can avoid the venom being circulated any faster. We also want to encourage them to avoid moving the affected body part. We want to remove any jewelry or tight fitting clothing because of swelling that will occur. We're going to wash the area with soap and water and try to keep it below the level of the heart so that it does not circulate any faster. Again, we need to get the individual to emergency care as quickly as possible. Other bites and stings that we could have to treat can come from spiders and scorpions. Again, we're going to treat this the same as we would an insect sting. Watch for severe reactions like severe pain at the site, muscle cramps, headache, fever, vomiting. These could indicate a more serious reaction and would mean that the individual needs transport to the hospital and more advanced medical care. Ticks are something that are very common in our area. We do want to make sure that if we find a tick, that we remove it as quickly as possible, because the longer the tick stays attached to a person, the greater the risk of catching some type of infection like Lyme disease is. Typically, we see ticks that are in place longer than 24 hours are the ones that are passing the Lyme's disease on to individuals. In order to remove a tick, you need to use a tick removal device or tweezers, and you need to grab the tick as close to the mouth or head as possible. We want to pull the tick straight up until the skin tense, and we want to wait for several seconds in order to try to get the tick to let go. Once the tick has released, we want to wash that area with running water and lots of soap. We do need to be concerned about the diseases that ticks can pass on to humans. Once the tick is removed, flush the tick down the toilet. Do not do things like cover the tick with nail polish or those types of things while it is still embedded. This can actually cause the tick to regurgitate its gut contents and thereby pass on more tick-borne diseases to the individual. Our next environmental emergency are heat-related emergencies. We have 3 heat-related emergencies that we deal with: heat cramps, heat exhaustion, and heat stroke. In many cases, most people have experienced heat cramp and heat exhaustion. Heat cramp is where we see an individual who has been outside, their muscles start to cramp up. They might experience these in their legs, stomach. Cramps are treated by stretching, icing, and massaging the painful muscles. Having the person move to an area to cool off and rest. We want to have them remove any excess clothing and have them drink something that contains sugar and electrolytes, such as juice or sports drinks, or water if nothing else is available. Our other heat-related emergencies can be a little bit more concerning. Heat exhaustion is a serious condition that can turn into heat stroke. This happens when a lot of times individuals are exercising in the heat and sweating a lot. But again, the individual who's suffering from heat exhaustion is still sweating. We will see them be nauseated, dizzy, vomiting, muscle cramps, feeling faint or tired. We may need to call 911 for this individual, so we really do need to monitor this. We want to have the person lie down in a cool area. We want to remove any of the excess clothing. We want to cool the person with water or ice packs. We could put ice packs to the back of the neck or underneath the armpits, the back of the knees. These are our pulse points. Have the person again drink something that contains sugar and electrolytes, or worst case scenario, if nothing like that is available, have them drink some water. Heat stroke is a truly life-threatening condition. It may look similar to heat exhaustion. Key signs that this is heat stroke instead of heat exhaustion are the skin is red, hot, and dry. This individual has stopped sweating and they've lost the ability to cool themselves. We also can see an individual who is suffering from heat stroke, suffer from seizures, and losing consciousness. This is a true medical emergency. 911 needs to be called. If possible, the person needs to be put in cool water up to their neck. If we need to begin the cooling process as quickly as possible, because every minute counts. If the person cannot be put into cool water up to their neck, we want to spray them down with cool water or apply ice packs to those pulse points. Again, the back of the neck, the groin, the back of the knees, and the armpits. We need to cool this person until they are once again experiencing normal behavior and are no longer confused. If it is possible for the person to drink, we should give them something to drink at this time as well. We're going to talk about two different types of cold-related emergencies. We're going to be talking about frostbite and hypothermia. We really do need to remember that cold-related emergencies do not occur just during cold winter months. We could have these cold-related emergencies actually occur during our very warm summer months on a 90-degree day in the middle of July. We could have somebody who works handling cold materials or refrigeration end up getting frostbite from exposure. We could have an individual who suffers a medical emergency and lays on a floor and becomes hypothermic. We're going to begin by talking about frostbite. Frostbite affects body parts that have been exposed to the cold for a certain period of time. This is typically found affecting things like fingers, toes, the nose, and ears. Signs of frostbite include the skin being white, waxy, or grayish. It is cold and numb. The skin feels hard and it does not move when touched. How we treat frostbite and the actions to take are: we first want to move a person to a warm place. We want to remove any of the wet clothing and dry them. Remove any tight-fitting clothing or jewelry. We do not want to rub the area because that can cause damage. Also don't want to try to begin to warm them up or thaw the frozen part if there is a chance of refreezing. We want to put the person in some warm clothes, cover them with a blanket, and slowly get them to warm up. Hypothermia occurs when body temperatures fall. Something important to remember about hypothermia is that it can mimic death. An individual can have such low body temperature that they can appear to be deceased. Again, remember that this can occur even when the temperature is above freezing. Shivering is something that helps produce heat, and when it stops, the body cannot keep itself from becoming cold. So in the case of hypothermia, shivering has stopped. Our individuals can appear to be very confused, drowsy, their skin is cool to the touch. There could be personality changes. Their muscles become more stiff and rigid. Heart rates can lower very low, and breathing may become very low or even stop. Actions to take for hyperthermia. We want to handle these individuals very carefully. Anybody with cold-related emergencies, we want to be gentle in handling them. We want to get the person out of the cold, out of their wet clothing, dry their bodies, put them in dry clothes and cover with a blanket. You want to wrap them up with anything you have, clothing, towels, newspaper. You want to make sure that you are covering the head, but not the face. You can place warm, but not hot things like hot packs or a hot water bottle in the areas of the groin, the armpits, the back of the neck, behind the knees. Those are our large pulse points. We have a lot of blood flow over those areas, so applying these to those areas increases the rate at which the individual will warm up. This individual does need medical attention as soon as possible, so we need to call 911 early and get them transported quickly to the hospital. Poisoning emergencies. When we talk about a poison is anything that someone swallows, inhales, gets in their eyes, or comes in contact with their skin that causes illness or death. Again, one of the biggest things here is scene safety. You need to make sure that you're going to be safe and it is safe for you to approach. You need to look for any signs that warn you that those poisons are nearby. Make sure you're wearing the proper protective equipment. You need to make sure you're staying out of the area with the poison if you see more than one victim. Try to determine what the cause of the poisoning might be. Calling the Poison Control Center can help you to figure out the best way to treat this individual. And how we want to proceed from there is we want to help the person take off any contaminated clothing or jewelry. We want to help the person quickly get into a safety shower or an eye wash station if they are able to move and those things are available. If it is a dry substance, we want to brush off that substance and keep it away from the skin, making sure you're doing this with gloved hands. We always want to make sure we are rinsing the contaminated area with lots and lots of water for at least 20 minutes or until someone with more training arrives. Often your work sites will have MSDS, material safety data sheets, for the chemicals that are on site so that you have an idea of what you are dealing with. When you call 911, you want to try to be able to tell the dispatcher the name of the poison, how much of the poison the person was exposed to, the age and weight of the person, and when it happened, along with your additional details of telling them how the individual is feeling and what their symptoms are. The last thing that we need to discuss is the treatment of drug overdose emergencies. In the U.S., we have many individuals that are dying from drug overdoses. These deaths are largely due to opioids. These can include heroin, methadone, morphine. Naloxone or Narcan is the medication used to reverse the overdose effects of an opioid. When we talk about an overdose, these individuals can be suffering from a cardiac arrest. Their breathing may be abnormal. They may be only gasping for air. In these cases, you will need to prepare to do CPR. You do need to be very careful in these cases because you could be exposed to the drug. So make sure you're checking the scene for safety, looking for any of the sharp objects. Make sure you're wearing your personal protective equipment. If the individual is in cardiac arrest, you can begin CPR. If it is available, you can give Narcan. Remember that Narcan is available for anyone to receive free of charge from pharmacies. If you are suspecting a drug overdose for an individual who is breathing normally, you can still administer the Narcan. There are no contraindications to giving the Narcan. You do need to realize, though, that in many cases, the individual can become combative after you have administered the Narcan because they have been taken out of that state of being high. You are now going to watch a short video on how to administer Narcan to an individual who has overdosed.
Naloxone is now available over the counter, meaning no prescription is required. In some public places, naloxone may be stored with an AED or first aid kit. If you know of someone who has naloxone and you are familiar with or have been trained in the use of naloxone, you may use it to save a life. Naloxone comes in several forms. Common forms are an intranasal spray and a pre-filled syringe. You can give naloxone by spraying it into the nose or injecting it into a muscle. Here are some general tips about how to use naloxone nasal spray. Hold the nasal spray with your thumb on the bottom of the plunger and your first and middle fingers on either side of the nozzle. Insert the tip of the nozzle into one of the person's nostrils. Press the plunger to give the entire dose of naloxone. Take the nasal spray out of the nostril. If the person doesn't respond within 2 to 3 minutes or stops breathing, use a new nasal spray to give a second dose of naloxone in the other nostril.
This concludes our American Heartsaver First Aid course. This is the lecture portion of the course. After this, you are required to follow the link and complete the assessment portion of the first aid class and follow up with the instructor for the practical portion of the Heartsaver First Aid course.